When assisting a patient with brushing, it is important to establish the patient's dominant side. Stand to the side of that patient's dominant hand. Then, holding the toothbrush in your own hand, place the patient's dominant hand over your hand. It allows the patient to feel that they are brushing their own teeth instead of having someone else brush their teeth. Then, place your free hand gently but firmly on the patient's shoulder on their dominant side. This tricks the patient's brain into focusing on the hand on their shoulder rather than the toothbrush in their mouth. Then guide the toothbrush into the patient's mouth and gently brush their teeth. Here we've provided an instructional video led by Teepa Snow on YouTube, and the link is provided here.
So here's Emil. So you right-handed or left-handed? Right-handed. Okay, so turn this way a little bit so everybody's going to be able to see us. Now, before I had you do hand under hand, right? Now what you're going to learn how to do is be the fine motor when they're losing it, the tool manipulation. So the reason I want her hand is her brain remembers her hand coming to her mouth. The reason I need my hand is she doesn't know how to manipulate a toothbrush anymore. So what I'm going to do is do the toothbrush. She is with me, and by being over here to the side, guess what? She literally thinks what? She's brushing her own teeth. Notice that I have my hand on her shoulder applying downward pressure. I'm tricking her mouth into not paying as much attention. Now you notice Emil's a little bit tender around here. She's not real fond of this. But let me take away the hand and watch what happens. Much more intense because I'm actually tricking her brain. This is close and it's proximal, and so I'm actually tricking her brain into paying attention to the pressure on her shoulder. Now watch this. So does it make a difference? Yeah, so I want each of you, and here's the deal. If you're going to be really good at this, you have to master both sides because you will have residents who are opposite dominance of you. And it doesn't matter what your dominance is. You have to use their dominance unless they've had a stroke, and you may have to use the remaining side. The reason you want their dominant side, that's where all the brain history is for fine motor tasks. Only one half of your brain has learned fine motor skills. The motor memories are not available on the other side. And so I've got to be on this side. It's also where it's going to draw her eye. Search and rescue will always tell you if the right person is right-handed, they'll make right-hand turns. If they're left-handed, they make more left-hand turns. It's an automatic behavior of the brain. So she will look at me more and pay better attention if I'm on her dominant side. So with your partner, give it a try.